Chapter 7, page 204. Reading: Drug Use and Abuse Worldwide. Although alcohol, tobacco, and other drugs differ in many important respects, including their legal status, they share important characteristics. They are all psychoactive substances with the potential for creating dependency, and they can cause very significant public health problems and widespread social harms. Global spread of substance abuse. Many social, economic, and political factors have contributed to the global spread of alcohol and other drugs. In the 19th century, drugs tended to only be available where they were produced, or very close to the source of production. However, the growth of transportation, tourism, and communications has made it possible to transport goods and people quickly to any part of the world. Drugs, too, are being transported to distant places. Given the economic rewards of producing and transporting drugs, it is not surprising that they are available almost all over the world. It has been estimated that the illegal market for drugs is worth between $100 billion and $500 billion worldwide. Reuters, 1996. There is enough evidence to indicate certain trends in the globalization of drug use and the cyclical nature of drug epidemics. Cannabis. Globally, cannabis, marijuana, and hashish is the most widespread and commonly used illicit drug. The United Nations Office on Drugs and Crime estimated the number of cannabis users worldwide to be 163 million people. UNODC 2003. In the United States, approximately one-third of the population over the age of 15 have tried cannabis, and 9.3% have used the drug in the previous 12 months. UNODC 2003. Similarly high rates of use amongst the general population are reported in Canada. In most countries, rates of cannabis use are generally higher in younger adults and higher amongst males than females. In Western European countries, data suggests that rates of cannabis use are lower than those reported in the United States and Canada. In some northern and sub-Saharan African countries, e.g., Egypt, Kenya, Morocco, Nigeria, and Tanzania, there is a long tradition of cannabis use for culinary, medicinal, and ceremonial purposes. Cocaine and crack. Cocaine and crack cocaine provide an example of both the globalization of substance use and the cyclical nature of drug epidemics. Traditionally, coca leaves have been chewed by people in the Andean countries of South America for thousands of years. The main alkaloid of the coca leaf, cocaine, was isolated relatively recently, in about 1860. Cocaine was then used in patent medicines, beverages, and tonics in developed countries in Europe, North America, and in Australia until the early 1900s. Laws restricting cocaine saw a decrease in consumption in these countries until the 1960s. From that time, cocaine use became popular among certain groups of young people in some developed countries and in the producer countries of South America. Cocaine became widely available in North America in the 1970s and Europe in the 1980s. Cocaine use is also gaining in popularity in some developing countries outside of the producer countries and in Central and Eastern Europe. In 2001, 56% of countries surveyed showed an increase in rates of cocaine consumption. The United States remains by far the world's largest single market for cocaine and crack. However, use of the drug has declined in the U.S. even as it increased in the rest of the world. After reaching a peak in the 1980s, cocaine use in the United States dropped dramatically in the final years of the 20th century, falling by 60% from 1985 to 2001. The rate of decrease slowed throughout the 1990s, and by the turn of the century, cocaine use in the U.S. had stabilized at a roughly constant level. This stabilization may demonstrate the cyclical nature of drug epidemics. Similar cycles of increase, stabilization, and decline, sometimes followed by further increases often after a period of many years, have been observed for different drugs in many countries. Heroin. The available evidence shows that there has been a global decrease in the production of heroin, UNODC 2003. Throughout the 1990s, worldwide cultivation of heroin has decreased 15%. Nonetheless, use of heroin is causing widespread health and social problems in many countries. In Europe, heroin injectors who regularly consume large amounts of different drugs face a risk of death which may be 20 or 30 times higher than non-drug users in the same age range. EMCDDA 1996. Since heroin is commonly used by injecting, the health risks, including that of HIV and hepatitis transmission, are substantial. The shared use of injection equipment has played a critical role in fueling a number of local, national, and regional HIV-1 epidemics. HIV-1 prevalence is high in drug-injecting populations in Southern Europe, the Northeast of the United States, parts of Asia, and parts of South America. Donahue and Wodak, 1998, Stimson et al., 1998. In the Russian Federation, HIV infection exploded in the first years of the 21st century, with about half the new HIV diagnoses caused by injection drug use. Drug injection in many developing countries is a relatively new phenomenon. Reasons for the spread of injecting are complex and differ from country to country. Certain factors are involved, however, including changes in the availability of drugs and the location of countries in relation to drug production and transportation. Drug injection has become widespread in some countries of Southeast Asia, where earlier patterns of opium smoking have been replaced first by heroin smoking and then by heroin injection. Stimson et al., 1996. In West Africa, the injection of illicit drugs is a relatively new phenomenon in countries which have no tradition of injection. Inhalants. The use of inhalants occurs in all regions of the world. Kozel, Sloboda, and De La Rosa, 1995. These substances are often used by children and adolescents, especially street children, many of them homeless. In all parts of the developing world, glue is the substance which is most often inhaled. It is cheap, available, and provides a rapid high when children sniff it from the container or from a plastic bag. Alcohol. Next to tobacco, alcohol is the most widely used and abused substance and is available in all but the most isolated areas of the world or in a few countries with strict religious prohibitions. Although alcohol consumption has recently declined in many developed countries, Smart, 1991, Edwards et al., 1994, its use has been increasing in developing countries, Saxena, 1996. This increase is often occurring in countries with no tradition of alcohol use and few methods of prevention, control, or treatment. Tobacco. Tobacco continues to be the substance causing the maximum health damage globally. According to WHO estimates, there are around 1.1 thousand million smokers in the world, about 1/3 of the global population aged 15 years and over. Substantially fewer cigarettes are smoked per day per smoker in developing countries than in developed countries. However, the gap in per-adult cigarette consumption is narrowing. Unless effective tobacco control measures take place, daily cigarette consumption in developing countries is expected to increase as economic development results in increased real disposable income. Tobacco is estimated to have caused around 3 million deaths per year in the early 1990s, and the death toll is increasing. Unless current trends are reversed, that figure is expected to rise to 10 million deaths per year by the 2020s or the early 2030s. By the time the young smokers of today reach middle and older ages, with 70% of those deaths occurring in developing countries. The chief uncertainty is not whether these deaths will occur, but exactly when.